Hello, my name is Haley Renzo. I will be presenting the teaching outline for suture removal. I am working with Maddie Mills, Paulo Fernandez, Jesse Medina, and Amanda Lopez. This is in partial fulfillment for NSG 309. To begin, our patient is a 21-year-old female. She's presented to the clinic in her own car with a 4-centimeter full-thickness laceration to her left mid-anterior shin. This is status post-fall while jogging. The bleeding was controlled and the wound anesthesiation initiated with 0.5% Sensorcaine with epinephrine per facility protocol. Our patient is now sitting and we will begin teaching. She reports 0 out of 10 pain. The things that we'll be going over that are the most important teaching points is going to be wound care instruction and discharge instruction that's going to be provided in her room before discharge. She will be given direction to return to this clinic, 7 to 10 days for suture removal. Some goals we have when teaching our patient is to Number 1, educate the patient on proper wound care and management. And number 2, educate the patient on safety measures of physical activity. The topics to be included in our learning objectives are going to be wound care, appointment attendance, abnormal assessment findings with the suture site, as well as normal assessment findings with the suture site, proper protection during physical activity, and the medications to treat potential infection and inflammation of the site post-suture placement. We have come up with 3 learning objectives for our specific patient. They are as follows. By the end of teaching, the patient would be able to demonstrate proper care of the suture site, such as changing a dressing and ensuring the site is dry and intact. The patient will be able to teach back abnormal assessment findings, including signs of infection of the site, such as abnormal drainage, redness and swelling of the site, and dehiscence of the wound before returning home. We would like our patient to be able to teach these back while they are in the clinic so that we ensure we are comfortable leaving her with her sutures as she goes home. And our last learning objective is during the 10 days prior to suture removal, the patient will demonstrate proper medication usage for pain and inflammation management, as well as decrease their activity to maximize healing before the sutures are removed. It's a large learning objective, but essentially we want our patient to be able to properly use medication in order to manage her own pain as she leaves the clinic, as well as decrease her activity to lessen the likelihood of infection or dehiscence of the current wound that has sutures now. When considering who our patient is and how they have come in, there's 3 teaching strategies that want to be implemented for our specific patient. These are her physical readiness, her emotional readiness, and her cognitive readiness. Physical readiness is going to be the patient's ability to focus on the information. For our scenario, this would specifically mean pain control. If our patient's pain is an 8 out of 10, it's going to be very hard for them to focus on what it means to have infection or how to change a dressing. So we want to ensure that our patient's pain is managed before beginning teaching. Luckily, as earlier stated, our patient is currently at a 0 out of 10 for pain. The second is emotional readiness. Is the patient emotionally ready? Is the patient anxious or depressed or stressed? After a fall, our patient could be feeling stressed or anxious because now they are in a clinic. She could also be having anxiety because she's never had sutures before. These are the things we need to address before teaching our patient and before giving her learning objectives and giving her goals. Because if she is not emotionally ready, everything will go one ear out the other, and she'll only be able to think about her anxiety or her stress. So we must manage that before starting learning objectives. And our last is our cognitive readiness. Does the patient have mental impairments? Can they think clearly? And what kind of education do they have or need, such as language barriers and education level? Luckily, we can assume because our patient is a college student, is 21, her first language is English, and she can read and write, we won't need a translator, and we won't need to accommodate in those ways, and she also denies any head trauma. So we can assume that her mental capacity is appropriate for this specific learning and this specific education. So our biggest objective is wound care. What we want to teach the patient includes keeping the wound clean and dry for at least the first 24 hours, as some physicians do like keeping it covered for the first 24 hours. What is important to note is after the initial 24 hours, the patient can now get her suture and wound site wet, but should not soak it. This means no swimming, no hot tubs, no baths. For actual teaching strategies, now that we know that our patient is cognizant and able to understand what we are saying and can teach back information, there's 3 teaching strategies that can be used for this patient: one-to-one discussion, demonstration, and printed audio-visual material. We can use the one-to-one discussion for keeping the wound clean and dry. This is just having a discussion with our patient and letting her know that she can shower 24 hours afterwards, or doesn't have to keep it covered in the shower, but she should not be going and swimming or bathing or in hot tubs. For our demonstration, while we are addressing the wound, we can as well be teaching our patient during that time and demonstrating to her what it means to put ointments on, what it means to put the dressings on, what it looks like for the sutures to be in place, intact, and we can teach her how to change the dressing, essentially. And that would be demonstration. And then our last one is going to be for the audio-visual materials. We can give her pamphlets or show her videos or give her online resources so that she knows what signs and symptoms of an infection would be. What does her suture look like when it is infected? Would it be warm? Would it be red? We can give her pictures so that while she is not in the clinic and in those 7 to 10 days before suture removal, she knows what to look for and she can compare it with audiovisual material. The last thing we need to do before we can discharge our patient is evaluate her knowledge and how much she retained from the material that we gave her. First, the patient should know how to properly dress the wound and how long to keep it for. This could be a mixture of the patient teaching us back or telling us what materials she needs for her wound dressing. She can tell us that she will not soak the wound prior post 24 hours, but she can get it wet, so showers are appropriate. She should also be able to tell the nurse ways to keep the sutures clean and dry, which is part of the wound care. The teach back method is going to be important in this scenario on how to clean the sutures, and the patient should properly demonstrate or verbally confirm what it might feel like or look like to have an infection in the wound. This is all also allowed with knowing the patient knows their medications, knows when to use them, and knows how to use them for pain management, decreased inflammation, and potential infection if it is needed. After looking at all of these and we are comfortable with our patient's knowledge and we know that she feels comfortable taking care of her sutures, and it's a very important thing that she knows that she needs to be back within 7 to 10 days and to make an appointment for that to get the sutures out, we can now feel comfortable discharging our patient and letting her go home and knowing that she's going to take good care of her sutures and be cautious for the next time that she goes out and runs.